Hi, everyone. Today we're going to be going over a few topics regarding disability etiquette. Um, I'll go ahead and start. For mine, I decided to focus on scent triggered disabilities. This interested me because I knew someone that had this disability. It was actually a teacher, but I just wanted to know a little bit more about that. Um, in the pamphlet, it said that some people become ill when exposed to strong fragrances and chemicals. This can be due to cancer treatments or just sensitivity to different chemicals. Um, Something it highlighted was to attempt to use a fragrance-free space. And if someone self-identifies with this disability, it's important to ask how they can be accommodated. Some ideas I came up with to also accommodate them is to provide a room with better ventilation, um, and no discernible odors, but sometimes it's hard with like cleaning products, things like that. So it's hard to know ahead of time if it's not written down in the notes or something, or they tell us beforehand. Um, some things that can affect the mammography is that the patient can start feeling um, different symptoms during the exam due to those fragrances, like nausea, dizziness, or headaches. Um, the patient can also become irritated, which may affect the stress levels for both the patient and the tech. So it's important to try and be um, as precise and like get the mammography as quick as possible, although that may be hard. To improve the situation, I feel like communication is key. It's important to communicate with the patient and kind of read their their body language, kind of like how they're doing. Um, like I said, trying to be precise and efficient with the images that you take. So, and then if it comes down to it, I feel like taking breaks might be an option, although that would definitely cause more issues probably in the long run. Yeah. Does anybody have questions about that disability?
I do. So you had mentioned something that you could do to kind of accommodate would be to maybe be in a room that has better ventilation in cases where like sometimes there's only one room where you could do mammograms in. So what would be something that you could do to kind of like help ventilate the area? You think maybe just getting a fan or I don't know.
Yeah, I would think a fan or if there's a window available, opening that up for a little while before the patient enters the room. But like I mentioned, it's kind of hard to anticipate that unless you know this patient and they're a return or they let you know ahead of time. So just using what you have available, I feel like is the best way to go.
Yeah, I feel like it might be hard to prepare beforehand for that because people don't always up front come say like, "Oh, I'm very sensitive to smell" or something like that until they smell something that bothers them. Um, but
Yeah,
yeah.
like I mentioned, I had a teacher in high school that was very sensitive to fragrances.
Mhm.
And until like the students, like I would come in and she would send us outside because she couldn't tolerate it.
Yeah.
So often like we would have like class outside or she would let us do our work outside like on the benches and stuff because it was a little too much for her. So
So maybe like an air purifier, right?
that
Would
could
that
be another idea. Yeah.
an air purifier would work? Because I wonder if like does the scent right away like trigger nausea? Or is it just a possible
They're just very,
symptom that
they're,
you would get?
or they're just very hypersensitive to anything. So, I mean,
Yeah, it's hard to tell. I feel like everyone might be different.
yeah.
I can go next. So I chose sensory disabilities, which includes people who are blind, low vision, deaf, or hard of hearing. The pamphlet discusses how blind people or any with any type of disability will undergo training to orient themselves to help them move around with less trouble, which can include using a guide dog or cane to help guide them. The pamphlet also lists that we shouldn't assume that they need help, so you should wait until they ask for it. It also gives you tips on how we can help them. For example, once you're meeting them, always identify yourself, and especially if someone else is with you, make sure you introduce them. If you decide to step away, make notice of that to them. It also talks about offering a tour, which I don't know if all sites would also be able to do this, but I think it's probably to help orient themselves. And also making sure you don't have such bright lights that can cause more harm to them. And if they also have a cane, make sure if they decide to set it down somewhere, you don't go and move it because that's going to reorient them. Um, for reading purposes, like information, it says you can offer to help read it, or some pamphlets will have a QR code that will help them. So it's going to auto translate for them so they can hear it. And then it also offers guidance for web access for people to make sure you include links that are descriptive and easy to find, enable keyboard navigation, and include transcripts for audio and video content, including bold colors. I think that this disability can affect a mammogram exam because you really have to emphasize and announce everything that you're going to be doing. As from the minute that you get them from the waiting area, you have to literally explain everything you're going to be doing. And mammo exam requires body positioning, like clear communication and physical pressure, touch. So without the proper accommodations, this exam can be a traumatic experience and maybe miss future screenings for them, especially because you do need to physically touch them and it's a new place with sounds. So I think that in order for a mammogram or a mammographer to improve the exam for the patient is, first of all, I think you need to extend your time. So make sure you have plenty of time to help them and not feel rushed. Because I think if a patient feels rushed, they're going to be like, okay, they just want to get me out and they're not helping me. So I think you need to let them before the exam know like exactly what you're going to be doing. Let them know that there is going to be sounds and that's just the machine. You're going to be stepping away from them. Ask permission to be able to touch them first before you do, not just go and physically move them before, and let them know that you're going to be applying pressure and touch. And if at any point they need you to stop, to just announce that and you'll be able to do that. And just make sure that you're announcing everything that you're doing. Does anybody have any questions?
So I guess what you would say, like the best thing that like a mammo tech can do to like better prepare for patients that have like sensory disabilities and stuff like that is to just be on top of like your patient communication and making sure that you're saying everything out loud. I feel like that's like really hard to do because I'm
Yeah.
like trying to think of something to relate it to that like we know like that we're comfortable with like x-ray, right? Like sometimes like I have to like show patients what to do like like as I'm explaining it because it's just so much easier if they like can see what I'm trying to like get them to do. So I could only imagine how much more difficult that would be for someone with like a sensory disability that you would have to like dictate or like say everything instead of just like showing them how you want to be, if that makes sense.
Which I think is hard, especially like as students, I still have trouble giving them clear directions. So, like you said, like it's easier to help show them what I want them to do, but if you can't actually do that, I feel like you really need to like, okay, take a step, a small step to the right, now step forward. But you also, I mean, I do it when I'm as a student, like I will help them move, but I can't do that because if I just suddenly touch them, they're gonna be like, wait, what are you doing? So I feel like, yeah, it's gonna be extremely hard to do that.
Yeah, as far you mentioned taking a tour, I don't know, like realistically, I don't know if a tour of the whole department really, but like it would be a good idea to be able to tour them around the room so that they can orient themselves to the like where they're going to be headed. But
I think it's also to help them like not bump into stuff to kind of get like a an idea, which is going to be hard if you don't have a lot of time.
Yeah.
Yeah. What do you think might be the biggest like misconception with these types of patients, knowing that, you don't immediately have to help them and more so wait until they ask you for help? Like,
Well, I think biggest misconception. Well, first is rushing to help them. And I was in a, I've been with a patient who is blind, and I don't know why, but I feel like as techs, you get louder, which is not, they're blind, but
yeah.
you don't need to, they can hear you. It's just, I
Mhm.
feel like I don't know if it's because they can't see you, but I also did notice like the tech was very helpful in the sense like, is it okay if I move you? Okay, so you're standing behind a hard plate. Now there's a light and we're gonna step away and we're gonna shoot the x-ray. So I did see that, but I did notice that the tech got a little bit louder. I don't know if
Mm,
it's because also we were stepping away or if we just lead one with the other.
got it.
I can go next. I just looked at the pamphlet and chose to talk about a neurodivergent patient just because it affected the most people in the US. So anyone that has like a cognitive disability, their brains work differently. It could mean autism, could mean ADHD, it could mean Tourette's, a brain injury. There's so many people with a wide variety in this category. So it's important to be patient with these people, be open-minded. I think the main thing that emphasizes in all of these, right, is clear communication, and to work at a slower pace with them. So you're really going to want to explain stuff to them, and it said to use concise language with them and no jargon. And also, you mentioned before to like adjust sensory factors. So, like the temperature in the room, the lighting in the room will really help reduce their anxiety. And it was important to not, like, if they have a family member with them that's wanting to help, to not automatically defer to them, to the family member or the caregiver, and to talk to the patient first. And yeah, don't talk down to them. Be mindful. Um, yeah.
Mm,
What
I
do you think some, oh,
Sorry, go ahead.
what do you think some challenges might be working with neurodivergent patients?
I just think they could easily be flustered, right? So you need to um, be calm and be able to explain stuff to them slowly, step by step, so that they understand. Yeah.
So what communication techniques do you think would be most helpful for patients who might become like overwhelmed or they might have difficulty processing a lot of instructions? Would it just be to like go slow, like really be clear
So,
with stuff and making sure that you're kind of, I don't
clear,
know.
direct, calm, like keeping eye contact with them, um, be just making sure that you're patient with them and open-minded. Yeah.
Do you think, because you mentioned it's a little bit to the sensory, do you think also maybe giving them like a pre-tour of like where everything's at and maybe the noise would help them versus
Yeah.
the noise just kind of freaking them out because the machine
Yeah,
does make noises?
making sure that they know that there are going to be like the cold when you touch the plate and that it's going to make noises, just preparing them for all of these things. Yeah.
All right. So I also did scent triggered disabilities. So I might be reiterating a couple of things that Andrea has already said, but some of the information in the pamphlet, some people can become ill when they're exposed to strong fragrances or chemicals. It could be due to, like Andrea said, like cancer treatments. They just have chemical sensitivities or other reasons. The pamphlet does suggest, having a fragrance-free space to limit the chance of someone becoming ill from perfumes or like strong scented cleaning supplies. My view on how this can affect a mammogram is I think some ways that it can affect it is that if fragrances are present, they can trigger like migraines, dizziness, nausea, difficulty concentrating, or like fatigue. And sensitive individuals, patients with scent trigger disabilities can experience like coughing, wheezing, shortness of breath, or chest tightness, which I feel like could be a really big factor in mammograms. And then I feel like if a patient is worried about like encountering fragrances, they might become anxious before or during the exam, and it can just make it more difficult for them to relax and like be properly positioned and like ready for like the compression. At clinical, although it wasn't mammo, it was just X-ray. There was like a patient that was like in the ER room and they needed like an elbow X-ray or something. And like when I walked in the room, her perfume was so strong. Like you just like took one step in there and it just kind of like hit me. I was like, oh my gosh, it was like a really strong floral perfume. And the whole time I was in there, like trying to position her because it was like a portable, like I was just in there sniffling and like trying not to sneeze. And it was really hard to concentrate on what I was doing. So I can only imagine what someone with like a scent trigger disability would experience if they encountered a scent that would trigger their disability in any sort of way during like a mammogram or like any exam, you know? And so I feel like what we could do to kind of improve the exam for the patient would be to like avoid wearing perfume, cologne, or like heavily scented lotions while working with patients and making sure that we minimize the exposure to scented products in the exam room if possible. And then maybe just asking and putting it in their chart. Like if it really is like a severe case, like, like they cannot tolerate any fragrances whatsoever, like I think it'd be a good idea for like the next person to know.
I think it's a sensitive thing, right? Because if how if she is sensitive to smells, it or it's hard to for them to say in a nice manner, like, oh, you stink or you
Yeah.
so how like I don't know how you approach that subject without someone's feelings getting hurt or like getting a little offended, like, oh, they said that my perfume's too strong.
hmm
Yeah.
Yeah, and at least in that situation with that lady, like it wasn't my place to like say anything. Like it wasn't, like she was there in the ER. But I feel like if someone has like a scent triggered disability, I think they could just call in ahead of time or just be like, hey, like I'm really sensitive to fragrances. Like, could it be possible for me to like have someone, whoever's doing my exam, make sure that they don't have like strong fragrances on because it like really creates like really bad symptoms for me, maybe something like that.
One question that I was thinking while I was reading into it was I wonder if it'd be appropriate to reschedule them if it was that bad of a case where, they couldn't tolerate it at all and we weren't prepared ahead of time, we didn't know. Um, like, would that be acceptable or appropriate? Because I know that for mammograms, most of the time it is a scheduled exam,
Mhm.
throughout the day from 7 to 4 or 5. There's no space to really elongate an exam for one person. Um, what are your thoughts on that?
Yeah, I know there's like it sucks. Like, but I feel like we need to put the patient first. If they really are ha like struggling, they're dealing with like all the symptoms, dizziness, nausea, they cannot continue with the exam. I think you would just have to reschedule. Like you want to make sure that they're comfortable and that they're able to have the exam like completed
Yeah.
comfortably. Like they should have that option. So, it sucks having to reschedule it, but if it ends up being better for the patient and a better situation for them, I think it's just something that has to be done, I guess.
I think my question is is there a scent triggered like by the slightest smell. So in like for instance, if we clean the equipment, I know it has a smell, right? And we're supposed to wait a certain amount of time. So I wonder if like we would have to wait longer, and also maybe if it is in her chart, maybe scheduling her as the first patient versus waiting for all of these other patients, which in general, like I mean, for mammo, you should not have any deodorant, any thing that could affect the scan. But that's why we have those little wipes so that they can clean them. But I think the smell would still be lingering.
Yeah, I mean, I feel like it would definitely depend on the patient. And, some people might be really affected by like the small like scents like that, but other people they might be fine and it's just like when scents are stronger. So I wonder, I feel like yeah, like it would be like if it is in their chart, maybe just be the first patient in and out the door. Just
Or
so that way they don't have to struggle.
like if someone is undergoing chemo and having this as a side effect, maybe it's highly sensitive during that treatment of that time. And if they're willing to reschedule, granted, some people wait long times for mammos, uh, scheduling them like 2 weeks later to see maybe if the nausea or the smells are not as sensitive after the chemo wears off or something like that as might be an option.
Yeah, I agree with that. Yeah.
All right. Cover
Okay.
everyone.
Anybody have any questions? Okay, I think we're done.
Right, thank you.